Good evening from London, and hello from me, Dr. Dermot Hudson, the chairman of the British Group for the Study of the Juche idea, chairman of KFA UK, an official delegate of the KFA for the UK, and president of the Association for the Study of Songun Politics UK. Now, I've been busy at home doing a spot of painting and a spot of cleaning, but I thought it was important to take time out from that to make this video refuting many of the lies and slanders that the mainstream media is spewing out about people's career and the situation there. And of course, the imperialists hope to use what's happened, the outbreak of the Omicron variant in the DPRK to overthrow the socialist system. Let's be under no illusion about this, and they hope to benefit from the situation. But anyway, I was alerted to the fact that both The Guardian published an article slandering the DPRK, and also a health expert who I'd never heard of before, Dr. John Campbell, also made a video which severely misrepresented and exaggerated the apparent outbreak of COVID-19 in people's career. The Guardian piece, and we all know what The Guardian is, it's the middle class liberals paper, it's the paper of the chattering classes. Many people used to be under an illusion about The Guardian, that it's actually a left-wing newspaper, and of course it isn't at all. I think some people have realised that, particularly after it started attacking Jeremy Corbyn a few years ago. It's not left-wing, say liberal is probably a much better description of it. Anyway, the Guardian article on the DPRK turned out to be a syndicated article from the French imperialist news agency Agence France Presse, AFP. And of course I would point out to people who might scoff at the description of France as imperialist that it is indeed an imperialist nation in all senses of the word. It both exports capital and also has its troops in a number of African countries where they are exploiting and oppressing the African people. Anyway, the editor, or I should say the Asia Pacific editor of Agence France Presse, is none other than Oliver Hoffman. Yes, folks, Hoffman, who was the chief editor of the CIA fake news and disinformation website, NK News, has ended up in AFP. No doubt they were prepared to pay him more than NK News. And, I remember Hoffman was responsible for a particularly vile and slanderous attack on me and KFA UK a few years ago, and it's likely that he's written the Guardian article on the DPRK and COVID. It's really lame that the Guardian are just copying and pasting syndicated articles from imperialist news agencies rather than actually reporting news themselves. Most mainstream media stories on the DPRK are usually copies of syndicated articles, which in turn are copies of stories circulated by the South Korean puppets and the US CIA. The AFP article in The Guardian uses South Korean sources and quotes an official of the South Korean Sejong Institute, which is an anti-DPRK propaganda entity, and I believe was actually set up by the South Korean government, or I should say South Korean puppet regime, in the 1980s. Turning black into white, The Guardian ludicrously asserts that the DPRK has one of the worst public health systems in the world, quote unquote. Nothing could be further from the truth. In the DPRK, free medical care was introduced for factory and office workers in 1947, and in 1953 universal free medical care was introduced in the DPRK. Everyone receives free medical care from cradle to grave. In the 1960s, the DPRK had 16 doctors per 10,000 people, a very high level. By 2017, according to the World Bank, and I don't like quoting the World Bank, but there you go, the DPRK had 3.7 doctors for every 1,000 people. This was higher than South Korea, which had 2.4 doctors per 1,000 people, and of course medical care is not free in South Korea, and the United States with 2.6 doctors per 1,000. The World Bank also said that the number of hospital beds per 1,000 in the DPRK was 13.2 per 1,000, compared to 2.9 beds per 1,000 people in the UK. Quite a big difference, isn't it? So basically the DPRK has 4.55 times the number of hospital beds per 1,000 than the UK. How on earth can The Guardian say that the DPRK has one of the worst public health systems in the world? This is just a barefaced lie. We would add that people in the DPRK benefit from the section doctor system, in which doctors actually go to visit people in their localities and workplaces. Ironically, in the UK, as I'm sure people are going to put in the comments section of the video, it's actually impossible often to go and see a doctor in person. Instead, it's all dumbed down online consultations and phone calls. In fact, sometimes with our NHS in this country, you can't even actually speak to a real human being. It's all automated and dumbed down. I mean, this is all to cut costs. And then a video by Dr. John Campbell, who is a YouTuber and health expert, but although his work is respected by many, is no friend of socialist countries, and the video follows a very similar pattern to The Guardian. Dr. Campbell has never set foot in the DPRK even once. Campbell titles his video Disaster in North Korea, failing to use the correct title of the Democratic People's Republic of Korea, or People's Korea. However, whilst the outbreak of Omicron in the DPRK, which was previously 100% COVID-free, constitutes an upheaval and a matter of very grave concern, it should be remembered that Omicron is a less serious form of COVID-19, as was pointed out on the Yale Medicine website. And I quote, "The good news is that so far, BA 2.121 does not appear to cause severe illness and death," quote unquote. The DPRK took timely and prompt measures once the Omicron variant was detected. During the last 24-hour period, there have been 6 deaths from the outbreak of fever in the DPRK. Now compare this to the 1,000+ deaths from COVID-19 per day during the height of the COVID-19 outbreak in the UK. How can it be a disaster in the DPRK when the number of deaths per day is less than 100th of what it was in the UK? It should be noted that South Korea has 17 million COVID-19 cases and over 23,000 deaths from COVID-19. This is something the mainstream media never ever talk about. Dr. Campbell is clearly looking at the wrong part of Korea when talking about disaster. Dr. Campbell resorts to Orientalist and racist rhetoric when he calls the DPRK population, I quote, naive. Ever since the global pandemic started 2 years ago, the DPRK has carried out mass health education and always warned people about the dangers of COVID-19 and how it spread. Campbell wrongly said that only 81,430 people had fully recovered in the DPRK as of the 16th of May. But in fact, the number of people who had recovered as of the 15th of May was 648,630, and that figure has actually gone up, but it's now over 1 million people in the DPRK actually recovered from the disease. So the DPRK's efforts to control and contain the situation are in fact going well. Anyway, back to Campbell in his video, and he cites as a source an American neocon academic based in South Korea who's very anti-DPRK, and also, wait for it, defectors. And we all know that stories from defectors such as Yeonmi Park have been repeatedly torn to shreds. The fact of the matter is that DPRK actually did more than any other country to prevent the inroads of COVID-19. It closed its borders and they stayed shut for over 2 years. Other countries failed to close their borders. Also, the DPRK took countermeasures such as mass disinfection. Of course, it is indeed strange and curious that COVID-19 was able to enter the DPRK with the borders closed. Maybe the DPRK will comment later as to how the virus found its way into the DPRK. However, the possibility that in fact the US and South Korea deliberately spread the virus into the DPRK cannot be ruled out. Only a few weeks before the outbreak was reported in the DPRK, so-called defectors in South Korea claimed to have flown balloons containing anti-DPRK propaganda leaflets into the DPRK. Did the balloons, in fact, carry something else? And we must remember that germ warfare was used against the DPRK by the US in the 1950s. Campbell blames the DPRK over the issue of vaccination, but the Omicron variant in other countries spread among those who had already been vaccinated. So it is a red herring. The DPRK correctly rejected the fake humanitarian aid of imperialism aimed at destroying the socialist system. It rejected unsafe vaccines produced by the big pharma capitalist monopolies of the imperialist world. Campbell resorts to old anti-DPRK tropes about malnutrition. If malnutrition is a factor in the spread of COVID-19, that would mean that Britain and the US must have very high rates of COVID-19. And in fact, back in 2021, the director of the Research Institute for Nutrition Care of Children of the DPRK, pointed out, and I quote, "In our country, nutrition care of children is deemed a top priority affair, though everything is insufficient. But those styling themselves expert under the berets of the UN are distorting the situation in our country to give the impression that serious, quote, malnutrition of children, quote unquote, exists in our country. This cannot but be viewed as a black-hearted act of hostility to tarnish the image of our country. I vehemently denounce the hostile forces for abusing even the name of naive children, which should be respected as the most sacred one, for attaining their political purposes. No matter how desperately the hostile forces may work, they can never write off the bright and happy looks of our children. Taking this opportunity, I warn the quasi-media of South Korea taking the lead in the anti-DPRK smear campaign by echoing rubbish like information that no one lends an ear to." End of quote. Space does not permit me to deal with all the allegations and assertions of Campbell, but I would finally would like to take issue with the claim that there's poor housing in the DPRK. This is a lie. In the last 10 years, there's been massive housing construction in the DPRK with new streets and even new cities built. Recently, 10,000 new flats were constructed in Pyongyang, and another 10,000 are under construction in the Hudson area of Pyongyang. Housing is virtually free of charge, and there are no homeless people. How can anyone say there is poor housing in the DPRK? Well, perhaps, the answer is someone who's never been to the DPRK or someone whose head is filled with anti-DPRK propaganda. I have every confidence that the DPRK will overcome this severe challenge of the pandemic, by its own efforts. And I must say I'm very impressed by the efforts that the DPRK is making to counter the outbreak of the disease. For instance, mobilising army medical personnel to help, and I've read today how food and cooking oil and essentials have been supplied to the population. This is very laudable. I'm quite sure that the DPRK will win victory in the war against the epidemic. What we must do is to double and treble our efforts to expose and defeat the anti-DPRK propaganda, which has reached new heights, and also smash and expose the regime change efforts of imperialism. And as I said at the beginning, I'm sure that the imperialists see this unfortunate occurrence as an opportunity for them. And, as I mentioned in another video, the G7 issued a state communique which showed their intent to overthrow the socialist system of the DPRK. So let's defend Juche-based socialism. Let's defend the DPRK's independence with no ifs or buts. Thank you for watching this video. If you're not already a subscriber to the channel, Songun 007, please consider becoming a subscriber. And also to our affiliated channel, Korean Friendship Association of the UK. And, you know, please do more to tell people that this channel exists, and share the videos widely. Please tell people that KFA UK and the British Group for the Study of the Juche Idea and Association for the Study of Songun Politics exist. And please support us. Please support our public events and our online events. We're going to be doing a meeting in the West Country down in Taunton on the 28th of May. If you live in the west of England, you know, in Somerset or Devon or somewhere like that, please, you know, come and, to the meeting. We're also trying to do a live stream, you know, IT permitting. And lastly, you know, we have the lulu.com author spots. There's a number of books written by myself, but also other people in KFA and the British Group for the Study of the Juche Idea, and a few books written there collectively. Please check that out. Buy some books. Get your friends to buy some books, you know. And lastly, thank everyone for their support. We're doing well on the number of subscribers for the channel. You know, thank everyone for that, and say goodbye and have a great day.